Imagine waking up with a severe headache, high fever, and a stiff neck. Within hours, confusion develops. Seizures may follow. Without rapid treatment, permanent brain damage or even death can occur. This is meningitis. Meningitis is inflammation of the meninges, the protective membranes that surround the brain and spinal cord. The most dangerous form is bacterial meningitis, which is a true medical emergency. Normally, the blood-brain barrier protects the central nervous system from infection. But when bacteria, viruses, or other pathogens cross this barrier, they enter the cerebrospinal fluid and begin multiplying rapidly. The immune system responds by sending inflammatory cells into the subarachnoid space. While this helps fight the infection, it also causes swelling of the meninges, increased permeability of blood vessels, and cerebral edema. As intracranial pressure rises, blood flow to the brain decreases, increasing the risk of seizures, brain herniation, permanent neurological deficits, and death. The classic presentation is fever, headache, and neck stiffness. On examination, meningeal irritation may produce two classic bedside signs. Kernig's sign is pain and resistance when extending the knee with the hip flexed. Brudzinski's sign is involuntary flexion of the hips and knees when the neck is passively flexed. While these signs are classic exam favorites, they are not always present, so their absence does not rule out meningitis. Many patients also develop photophobia, vomiting, confusion, or reduced consciousness. In severe cases, seizures may occur. If the cause is Neisseria meningitis, look for a non-blanching petechial or purpuric rash, which may indicate meningococcal. Diagnosis is confirmed with a lumbar puncture to analyze cerebrospinal fluid. But if raised intracranial pressure is suspected, a CT scan should be performed first to reduce the risk of brain herniation. Treatment should never be delayed. If bacterial meningitis is suspected, start empiric intravenous antibiotics immediately, even before culture results return. Early treatment dramatically improves survival and reduces neurological complications. The key takeaway is simple. Meningitis is inflammation of the protective membranes surrounding the brain. The infection itself is dangerous, but the body's inflammatory response is what causes most of the damage. Remember the classic triad: fever, headache, neck stiffness. Recognize it early, treat it immediately, and you can save a life. This is the Why Medic. Subscribe for more high-yield topics.